I think the general understanding of estrogen receptor positive breast cancer is that it's a better behaving breast cancer. That's a fact. And we have more treatment options for that given its dependence on estrogen receptor signaling. And there's several different ways to modulate that. So in clinical practice, you get a sense for how a patient's going to behave from their response to antiestrogens, whether they have disease control, have a response. But then there's a group of patients who we know don't do well with antiestrogens. Even though they're ER positive, they have a rapid progressive course. They don't have disease control despite several estrogen manipulations, or in the adjuvant setting, they have a very quick relapse after surgery and while on antiestrogens. But that's a clinical assessment. The molecular data that's been generated over the past several years that we reviewed has identified certain molecular characteristics of ER-positive breast cancer that defines a subgroup of patients that don't do well and have a more aggressive or virulent disease. The challenge has been incorporating that into our daily clinical utility, that when we have a patient who's ER positive, do we know they're going to be one of the good ER positive patients or one of the aggressive, virulent ER positive patients?